am Dr. Vijayakumar Narayanan. I did my basic medical graduation from Kerala, South India. About the prostate cancer. Prostate cancer is usually an adulthood disease. Usually young men will not have prostate cancer. Prostate is a gland in the male genitourinary system, a gland that is sandwiched between the urinary bladder and the rectum. So it is sandwiched in between these two organs. This prostate gland becomes slow, it can enlarge. When the age advances, the size of the prostate gland also can enlarge. As I told you, because of the strategic location of the prostate gland, it can cause problems of passing urine and all. Mostly, prostate enlargement is diagnosed with the symptoms of urine-related issues for the men. When a person is going to the washroom, he is not able to pass urine immediately. He has to hesitate few minutes or few seconds just to start the flow of urine. It's called hesitancy. Then after finishing the urination, he may not be able to complete the process of urination. Some few drops may drop, then fall in. We call it as precipitancy. And then when you go to this thing, multiple times in the night and all, when you sleep, your sleep will be disturbed. You have to rush to the washroom quite often. It's called frequency. So this frequency, precipitancy, hesitancy, and all those things, when you have these kind of symptoms, you need to seriously think about the possibility of enlarged prostate gland. The enlargement of the prostate gland doesn't have to be always malignant or cancerous. The same way as I told you about the breast cancer. All the lumps in the breast doesn't have to be breast cancer. Similarly, all the enlargement of the prostate gland doesn't have to be prostate cancer. There are two types of prostate enlargements. One is benign enlargement, other is malignant enlargement. So benign prostate hyperplasia, that is a common thing. Most common is benign prostate hyperplasia. How we diagnose prostate cancer or benign prostate hyperplasia? There are many ways to do it. If the prostate gland is so big enough to block the urine completely, then we will do a small procedure that is not by oncologist but by urologist. They do a small endoscopic procedure called TURP. TURP stands for transurethral resection of the prostate gland. They put an endoscope through the penis, reaches the prostate gland and remove the prostate gland in piecemeal. And this flow of the urine will be ensured. So once you remove this tissue, then we will subject it to testing, microscopic testing. Then the pathologist will tell us whether it is a cancer or benign one. So if you are having a benign prostate hyperplasia, you don't have to worry much about it. There are excellent medications to control it from growing further. And if it is causing further obstruction, when you can even have one more TURP procedure. But if it is malignant, then again I told you, for a cancer treatment, we need to stage the disease properly. You have to do some. Prostate cancer is very unique in its nature because it has a propensity, it has a tendency to go to the bones. The statement is like this: prostate cancer licks the prostate but it bites the bones. So we need to find out whether the cancer has gone beyond the prostate gland onto any other part of the body, especially to the bone. We have to do a proper workup like bone scan, MRI scan of the pelvis and all. Then based on that staging workup, we plan a treatment. There are different ways to treat the prostate cancer. One is surgery, radical surgery, remove the entire prostate gland and lymph nodes in the near vicinity and all. You have direct surgery in the theater, or you have robotic surgery, you have the cyber knife treatment. Then the other treatment is radiohormonal therapy, radiotherapy and hormone treatment together. This is one interesting fact about the prostate cancer is highly dependent on the male hormones. If you block the hormones of the male man, or you emasculate them, or what you call it as castration, it's a derogatory word, but I'm just using it as a medical term, medical castration. We block the male hormones, then the gland, the tumor growth also will be hampered. So we call it as androgen deprivation therapy or ADT. This is an integral part of the prostate cancer management. So we will use this radiation therapy as well as hormone therapy hand in hand. We call it as concurrent radio-hormonal therapy, with which we get a very good response to the treatment. So this is how we usually manage early stage prostate cancers. But if it has advanced, say for example, if the tumor has spread from the prostate gland onto the bones and all, then the treatment will be different. Then it is going to be palliative in management will be palliative. We focus the area where the prostate gland is causing more trouble. So if it is on the hip area, the patient has got an impending fracture of the hip bone, then we will focus some radiation to that area to stabilize the bone. Then we continue the hormone treatment. If the hormone treatment fails, then we have systemic treatments like chemotherapies and all. Nowadays, there are so many new advancements that is happening in cancer management like immunotherapy and all. Fortunately, we have now availability of the generic formulations of the immunotherapy combinations as well. So we can offer any form of treatment for prostate cancer as well. Thank you for joining with me for this discussion on cancer, especially the breast cancer and prostate cancer. I'm an oncologist, and you can book my services through ponea.com, and ponea.com is a wonderful service provider for different specialties of medicine, and you can access my oncology services through ponea.com. Thank you very much.